All right, take it away.
Hi, everybody. Welcome back. I know there's a lot of new faces. Corrine, myself, and Kimberly are the nurses for Burbank in the Diagnostic Center. The not so great news is that we are not on campus currently and don't know when we will be. So we will not be there Monday to welcome everybody back. This is just a quick little overview of some of the major things that you may run into with the kids at Burbank. And it was prepared by nurses in the elementary, middle school, and high school. So some of the things don't really pertain to Burbank, but that's okay. So we're hoping that you'll know what our job is and our responsibilities by the end of this. You'll be able to identify some common things that we have at Burbank and signs and symptoms and how to respond to what you see. And I don't think we're going to demonstrate the proper use of the epinephrine auto injector because neither Corrine or I have one to show you right now. Next slide, please. So these are your people, and we are available by phone. And I was unable to get our phone numbers in this slide. You can email us, but maybe Teresa can, or I'll have Karen send out an email to everybody with our phone numbers on it. And we're available every day. You can call us. So this is a little pie chart of what our jobs are supposed to be. And the different thing with this chart and Burbank is that big green pie on the bottom, for us, the nurses at your site encompasses the light blue one and the yellow. We're all special ed. We don't do cost, SST, or 504 at Burbank. But we're supposed to, we're supposed to do staff training, assist with medication and specialized procedures if there's not staff trained on site to do those. We do a lot of billing, case management with families, and we don't do mandated screenings for Burbank, but we have to do hearing and vision screenings for the Diagnostic Center, which we're not doing right now. Next slide. It's really hard for me to see too. Okay. So a lot of the stuff you'll see in your classrooms is minor first aid. In my experience, the kids at Burbank get bloody noses. That's kind of the major thing. And you have gloves on, use tissue, paper towel, gauze, whatever you have, squeeze their nose like way up high. And they hate that, really tight for about 5 to 10 minutes. And the other thing you can try is an ice pack on the back of their neck, and it should stop. The children at Burbank get very upset with bloody noses, and they smear it everywhere because they're crying too. So it can look a lot worse than it is. Bloody nose looks bad, but it typically is not as much blood as you think it is. Since the kids at Burbank, a lot of them are nonverbal, they don't typically mention that they have a stomach ache. And if they do, it's probably because they're constipated and not pooping. And there's not much you can do about that at school, but just mention to their parents that they complained of a stomach ache at school. I've never seen a child mention that they have a headache, but that's typically meaning maybe they don't feel well. And you could also call the parent and they can come and pick them up. And then there's when to send sick students home, but it's too small and I can't read that, Corrine. Can you make it bigger? Yay. Oh, on the side. Okay, well, you're going to see me. I'm going to take off the video so you won't see me taking my glasses off and sticking my face right at it. Well, nobody's going to be at school if they have a fever, right? Because they're going to do health screening before they come to school. If they get any kind of fever at school or any of those symptoms, they're going to be put in our sick room and parents going to be called and they're going to leave. None of these should apply because they're not going to be at school with this unless they have a doctor's note saying it's allergies and it's not, and that they're not just they're sick. Difficulty breathing would probably be the asthma, and we'll go over that in asthma. And then, well, hopefully their parents have noticed before they come to school that they may have pink runny eyes, but they should not be at school if they have pink runny eyes. And you can also call their parent to come pick them up immediately if they have that. And the next slide, Corrine. One really important thing, since we're not going to be there currently, is no parent can give you medications to give to their child without there being doctor's orders on site. There are a few parents that will be bringing medication for seizures on Monday, Diastat, and we do have orders for some children for that, and I'm not quite sure. We haven't worked out the details of how that's going to work on Monday. I guess we're going to have to prepare a list and let you know what we have orders for so that you can accept medication, I guess. But you cannot give any medication if the parents say, my child may need this today, here, you can ask them, does the nurse know? Have you spoke with the nurse? Do we have orders? Oh, we don't? Okay, take this home, take down their name, and a nurse will call them and get what we need. Either the school nurse or designated personnel that has been trained are the only people who can assist the child to take medication. And they have to have written consent also from the parent authorizing us to give this medication. The medication has to come in an original container with a pharmaceutical label on it, and it has to be for the child, and it may not be expired. It can't be grandma's inhaler. It has to be Marquisha's inhaler, and it can't be expired, and it has to be in the original package with their name. Next slide. Oops, there's my video. We're back. Students with a chronic illness list. I can't read that at all. I believe this is, you will have this for your classroom, and since these children don't move around to different classrooms, they're going to stay in their little pods, you will know who the students are in your classroom. There's not very many of them coming back with health conditions, and we'll put that out. Next slide, Corrine. So the prevalent chronic conditions we currently have at Burbank are asthma, severe allergies, seizure disorders. We don't have anybody with sickle cell, have not had any child get a concussion at Burbank. And hopefully they'll be supervised well enough so that they will not be getting head concussions. And there's nobody there with diabetes. Yay. But there's lots of other, in Noelle's class, there's children, Corrine, I can't remember the name of the, is it hypothyroidism that they have?
Yeah, but cortisol dependency.
Cortisol dependency.
Main thing, or adrenal insufficiency.
Yeah. Noelle
has different
a,
names,
yeah,
essentially meaning similar or the same thing.
And those children there receive an injectable form of medication if they're under any stress or become ill at school. And since they won't be coming to school ill and won't be at school ill, we're hoping this is not going to be a problem in the next 6 weeks. Next slide. Asthma. Typically with the little children at Burbank that have asthma or a history of asthma or medication for asthma-like symptoms related to colds or allergies, they're not going to be at school if they're sick with a cold, so this shouldn't be a problem. And as Corrine was discussing with me today, most families she's called that have asthma, none of the children have been sick this winter because they're not getting sick because they're not in school. And these little guys, the thing that the way they present the soonest at school is just kind of a cough that doesn't go away. They're just like they just keep coughing. It's rare that they wheeze. It's rare that they have difficulty breathing. That's more with the older children. And if they have asthma and we have orders, they can receive puffs with their spacer and mask. Next slide, please. And it's always important if they, well, hopefully it won't get to this point where you have to remain calm, that they're not going to, it's not going to accelerate into something really serious. But if they're constantly coughing, you can have them sit down, get their inhaler, and have them do their 2 puffs or whatever the orders say. They should be sitting in a chair. They probably won't want to, but you can have them sitting on your knee, and we'll give you instructions on how to use the inhaler. A lot of you already know how to do this, and it should relieve the coughing. And if there's no improvement after 5 to 10 minutes, these instructions say call 911. I would call their parents and let them know before you would call 911. Call 911 immediately if they are having difficulty breathing. If their lips are blue, their nails are blue. For children with darker skin, sometimes it's easier to look in their mouth and see if the color's changed inside their lips. But I have not seen any child at Burbank in all my time there have difficulty with asthma. They're just coughing and ignoring it, and then they get an inhaler and feel better. Next slide, please. And this is how to use the inhaler. And the next slide is the one for the spacer and mask, which the little children should be using. So you take the little, first, you look at the box, it has the child's name on it, make sure it's the right child. The little medication is in a metal vial and it's in this little plastic spacer. I always take the little metal vial out to verify that it's the medication that they should be getting, because sometimes kids get several medications and parents put the wrong medication in the box. Then you shake it, you put it in the end of this tube, which is a spacer. And our kids typically have a mask on the end of theirs, and the mask should fit over the nose and mouth. And so you put this whole device over their mouth and hold it, and they're pretty used to it. And then you push the inhaler down, and then just have the child breathe in and out. And there's a little valve, and you can watch it move. And that way you know the child is breathing the medication in. And sometimes, usually it's 2, they have you do it 2 puffs. So I usually watch the little flap going back 10 times. I give them a break, put the spacer and the mask back on, depress the inhaler pump, and have them do it again. And they're not going to hold their breath. So these instructions say hold their breath for 5 to 10 seconds and breathe out slowly, and they can't follow those instructions. Anaphylaxis is a severe allergic reaction to something they've come in contact with, and the children at Burbank, it's typically food, something they've ingested. And I think we only have 1 child coming back. Is that correct, Kareen, one of yours? Just 1 right now coming back with that. So typically what happens, there can be a mild reaction, and then there can be a severe reaction. And the orders that we have, it's called an allergy action plan. And there are instructions for mild reaction and severe reaction. And for mild reaction, they might just get a little bit of redness around their mouth. They may get some hives and be itchy. And we would give an antihistamine if the doctor's ordered it. They may order Benadryl. If you do have to give Benadryl for a child with a mild allergy, definitely call the parent and let them know. If they have a severe reaction, it can happen within seconds to minutes. Their lips will get all swollen. Their airway becomes constricted and they're wheezing. They may become very pale. They're incredibly anxious. Their hands may swell. They may have diarrhea immediately. They may have vomiting. And this is a severe medical emergency because their airway is not functioning. So you have to give the EpiPen immediately. And the EpiPen is only buying you time. You have to call 911. When you give the EpiPen, you call 911 and they have to go to the emergency room. The EpiPen only lasts about 15 minutes. And some older children will have orders to give a second dose of epinephrine if 911 hasn't called within 15 minutes. And you can give an EpiPen through pants. You don't have to pull their leg up. You can just, slam it through their pants. It's scary, but it helps and it can save their life. Next slide. Seizures. We have lots of children with seizures at Burbank. There's many different times. Many different kinds. Typically for a child with a seizure disorder, you wouldn't, and you know about it, they're probably on medications, or they should be on medications that they take at home. 911 does not need to be called if they have a seizure action plan and emergency medications to give. Some of the orders for the children will say, give it immediately if they're having a seizure. Some of the children, it says after 5 minutes, the seizure hasn't stopped, give the emergency medication. The standard is a child's having a seizure, you make sure they're on the ground or that they're in your lap, lying on their side, they're comfortable, they're protected from falling, there's nothing in their way that they're gonna bump into if they're really moving around. And you glance at the clock and you immediately start timing the amount of time that's passed for the seizure. Once you get to 5 minutes, which is a really, really long time, that's where you usually have to take action. If they've never had a seizure before and you don't know if this child has a seizure history, 911 needs to be called. Or the medication needs to be given at that point. A lot of times there are some orders for kids, if they have a seizure and it only lasts like, half a minute and it stops. And then if they have another seizure and it lasts a little bit and then it stops. So if they keep having seizures, you may have to give the medication also. It's important to review each child's seizure action plan so you know what to do. There's designated trained staff because this medication is typically given in their bottom, rectal diastat, and you have to be trained how to give it. The parents give it at home, but staff at school has to be trained and they have to be volunteers. And currently, there are 2 paraprofessionals who went to the training, and that was in the fall, and that was Monai and Dion. And then I know Alicia was trained last year to do the diastat. So I'm not sure what the plan is going to be this year. I'm not sure what classes, who's the paras in the classrooms that these children are in. There is one child with a seizure disorder who did have them at school last year on a regular basis. And she has a new medication this year, and it's a liquid, and it's given in a dropper under her tongue. And that will be delivered by mom on Monday. And we have orders for that. You mostly want to make sure they're lying on their side or you're holding them in case they're throwing up or there's secretions coming out of their mouth. You want to make sure it's draining out and they're not choking on it or swallowing it. You want to make sure of the time that's elapsed since the start of the seizure and when it finishes. And these children should have binders, and there's a seizure log in the binder where you would chart all this stuff. And that's where their orders are, phone numbers to call. And if you give a medication, it's also in there. Let's see what the next slide is. No, we don't have diabetes, so we don't have sickle cell. Head injury. Okay, so any kind of bump or jolt to the head, I guess there could be a blow if somebody has a truck and doesn't want to give it up and they whack the other kid in the head with it. I guess that could happen with these guys. The most important thing is to really watch them carefully, especially on the playground equipment. And let's try and prevent this from happening at all. But what happens is the brain hits inside the skull when they're moved around from falling. And so we always have to send a note home to the parent with the signs and symptoms of what to look for, that your child, this is what happened to your child today, be on the lookout for this. And I think I like to call and send the note home, because then they feel like they're more supported when this happens. And we do have head injury forms at school in the office in one of the drawers. Okay, let's see the next one. Evaluate all head injuries immediately. It's good to talk to whoever saw what happened. If they're crying, that's a good thing. If they are unconscious, you need to call the parent, or if there's any loss of consciousness, you need to call the parent right away and tell them that they need to come pick up their child and contact the healthcare provider. Sometimes the doctors will tell you as a parent, if your child has a head injury, if they fall asleep, to wake them up every couple hours and check on them. Most parents don't want to do that. If their child's falling asleep, they're really happy their child's asleep and they kind of just watch them. Parents don't usually like to wake up their kids, especially if they have to do it all night. If they're throwing up, that's also another sign of a problem, and that would be a call to the parent to come pick up the child, and they would immediately need to go to their doctor. I've never seen anything serious happen like this at Burbank. Everybody's really good at watching the kids on the playground, and nobody's fallen from a high distance. The nice thing is these children are short and they don't have far to go to hit the ground. So the pressure is not going to be that hard. And we have a nicely padded playground out there. Next slide, please. And I don't think, it doesn't look like the video's working, right, Kareen? Oh, it is.
Yeah, oh, there it goes.
Is there sound with the video?
Can you guys hear it now?
I can't hear it.
Okay. I'm like, I can hear it, but probably because I have these in. Let me...
I hear it.
Maybe we should skip it because we only have a couple minutes left.
So I'm not sure how to make it have sound.
Okay.
But what I can do is I can email the link, or I can put the link in the chat.
Okay. Yeah, this is the form, and it really should be filled out by the person who witnesses it or knows what happened. And like I said, notify the parent via phone call and send a copy of the little report home. And it needs to be kept. We don't have a head injury binder, but either the teacher can keep it in the classroom or it can be kept in the CUME folder. I think we're almost done. Okay, so check your email. We're going to send them out to the teachers. We're not going to do any field trips. If anything, they'd be walking around the neighborhood, so that's okay. We don't do mandated hearing, and school nurse will train staff and teachers individually. We'll work with you on that, with that on a student by student basis. You'll only learn what you need to know for your kids in your classroom. Does anybody have any questions about asthma? Or seizures? Or EpiPens? You can also email us anything that you need to know or you might want. Can we walk to
hello?
downtown? No.
I have a question.
Okay.
So, for the seizure,
Yes.
the kids, are they supposed to have a band?
No, they don't have to have a badge.
Okay.
That would be nice, but that also costs money. And sometimes parents don't want to pay for that, or the child loses them. My own child has diabetes, and he, lost so many medical identification bracelets we gave up years ago.
Okay, so for the epinephrine, for the allergic reaction,
Yes.
are the teachers supposed to administer it, or we're supposed to bring the kids to the nurses to administer the epinephrine? If they
Staff is trained. Staff is trained. There's designated trained staff in each classroom that has a child with that, that would be giving it.
Okay, thank you.
Any more questions about any of the health conditions? And you can also all email us, Corinne and I, and we're happy to answer any questions. What we may be doing is, if you have a child with a severe allergy in your classroom and there's an EpiPen ordered, we would do a Zoom training as best we could without being there in person. There is a trainer that usually comes in the boxes where you can practice. And I know I have some in my drawers at Burbank too, where you can practice with the trainer. Same with extra inhaler pieces and the masks and the tube. I can't think of what it's called right now, but we have parts that you can play around with.
Here's my question.
Yes, Queen.
You're going to email the materials as usual. You normally give folders, but we'll receive this via email, right?
I will.
Those materials, those slides you were showing that have the content.
You will have access to these slides. I have made a binder for the child in your class, but I have not received medication for them. I have orders. So that binder will be available to you. Yeah.
Okay. So when are you coming here? That's my next question. When will you be on site as usual?
I do not know that.
So
I'm sorry. It's
So we
not a
don't
good-
know that at this time. However, I have been told that there's an agency nurse that will be on site beginning on Monday. I will let you, I don't know who the agency nurse is. I don't know much about this other than they are supposed to be here on Monday. So I will give you, we don't want to know too far in advance, Queen. It just spoils the surprise.
yeah, all right.
And so Queen Teresa knows more than we do. That's more than we know.
All right. We're here.
It will all work out.
Okay.
And then going back to the EpiPen, so we did EpiPen training as part of the lead para training in the fall. So Monaya and Dion are also trained to do that.
Kelly, I have a specific question about my student. I was wondering if you were able to get in contact with the mom.
Which one?
So I know this would be Samaya.
Yes, and she was supposed to bring the seizure action plan when she brings the child to school. We have no seizure action plan.
Okay.
So if Samaya comes to school and she has no seizure action plan, it needs to be clear to mom. And this is what I told her, that if Samaya has a seizure, 911 will be called.
Okay, got it.
And when I call families, you can always check ARIES for the most up-to-date information, because every phone call I make, hopefully every phone call is documented in ARIES and what we talked about.
Okay.
Okay, Thank you.
Yep.
Okay. All right, everybody, this will be available to you via video. I will put it in the fast facts for Friday in case people need a refresher or want other people and their staff to be able to watch it. And thank you, Kelly and Kareen, for putting this together so quickly. And everybody, please reach out if you have concerns about individual students, because we want to make sure, I know we're gathering a lot of information from families really quickly, and we want to make sure we have everything we need to take care of kids. So if you have a little kiddo in your class you're concerned about, please reach out.
And I just wanted to let everybody know, we'll send out our phone numbers, and that is part of our responsibility, is to carry our district provided nice new Apple cell phones we got this year. And we can send things to families with them. It's awesome. And it's our responsibility to be available during school hours with those phones. So you can call us and we should answer immediately. But if we don't, we'll be on a call with another family, leave us a message and we'll call you right back.
Yeah. So just because Kelly and Kareen are not on site, it doesn't mean they are not working.
Mhm.
So we can access them as much as we need. Day or night.
Yes.
Our
that's a
day is
wake
over
up.
at 12:15.
3 a.m.
Starting from 6 a.m.
It's turned off.
Call them at 3 a.m.
Parents do call at 5 and 6. So
All right. All right.
Thank
Thanks,
you,
everybody.
All right.
bye.
Thank
Bye.
you, everybody.
Bye. Thank